Well, no story is as great and as special as a homegrown success story. And that's the story of Spark Therapeutics. Spark Therapeutics was born in March of 2013 as a result of the technology and know-how developed at the Children's Hospital of Philadelphia. It's where the first FDA-approved gene therapy for a genetic disease was created. The approach to gene therapy at Spark is straightforward. Investigate treatments that go to an inherited disease at its root. The specialness of the Spark science is universally recognized, and it is why global biopharma company Roche has made an offer to acquire Spark. The expertise of the Spark operation here in Philadelphia has caused the Roche leadership to make a significant and smart decision. Upon the close of the deal, Spark Therapeutics will continue its operations in Philadelphia as an independent company within the Roche Group. Here to share more is Spark Therapeutics' Chief Executive Officer and co-founder Jeff Marrazzo, who himself is a homegrown success story, born and raised in East Falls neighborhood of Philadelphia. He told me he grew up watching me when he was just a really little boy. Please welcome Jeff Marrazzo.
It's not every day that a born and raised Philadelphia Eagles fan gets to be introduced by a former Philadelphia Eagle. So this is quite a highlight for me. Thank you, Vi. And it's wonderful to be here. The theme of this meeting for all of you that are attending this week at the Bio Conference is that it starts with one. And for me, about 8.5 years ago, it started with a single meeting with Dr. Kathy High, who was then the head of the Center for Cellular and Molecular Therapeutics at the Children's Hospital of Philadelphia. And that single meeting led to an exploration of ideas that we thought ultimately could be taking that great science, that great research that was being done there, and trying to broaden it, expand it, and see if we couldn't create a vision and a mission for a company that could, by capturing even more capital, build an organization that one day could create a world where no life is limited by genetic disease. And that's our vision at Spark. And as Vi mentioned, we're very excited about the prospect of doing that at even greater scale and at even more pace to try to treat more patients with more diseases faster through the potential pending relationship with Roche. And so, as I said, we began those conversations in February 2011. And it was a simple decision for us. In fact, there was really no conversation about where we were going to start the company, where we were going to build the company. All of us, myself included, but Kathy and Steve Altschuler, who was the then CEO of the Children's Hospital of Philadelphia, all knew that we were going to begin the company in West Philadelphia and grow the company in West Philadelphia. And so 6 years now plus since we started the company, we have been able to try to tackle multiple different genetic diseases, as Vi said, at their root cause through gene transfer. We have brought the first gene therapy for a genetic disease ever to patients and families. And tomorrow at the beginning of the Bio Conference, you'll get a chance to meet through video and otherwise one family that's been impacted by our first approved therapy, Luxturna. It was an obvious choice for us to locate here, not just because all of us had roots here and we felt it was the right thing to do, but it was also because this is home to more than, as you heard it already spoken about, more than 85 hospitals and clinics. And so when you thought about doing clinical research and clinical development, especially in areas of rare disease where, frankly, as Brad can speak to, each of those trials, each of those trial participants, there is so much a personalization of the approach and what you need to do to be able to work with those sites on very, very small studies, that it's critical that you have the ability to have a very high-touch interface between those. And so being able to interact with that many different hospitals and clinics was critical. As you've heard about, it was clear back then, 8 years ago, that cell and gene therapy was an area of research that had promise. And had been worked on for more than 2 decades here in Philadelphia. And if we could unlock that promise, we would be sitting here as we are today, I believe, at the beginning of what is multiple decades of taking this technology and really making it go from what has been a niche area of science to an area of science that can broadly apply to many, many different diseases. That hope, when we started it in 2013, I will tell you that my hope was that if we could have some success, much like other regions around the country who have had success building biotechnology hubs, that one success or two successes would beget more, that more people would come and say, hey, could we find a way to do what others have done and build on their success, and perhaps have people even graduate from organizations like ours into those other organizations. And that is happening today. There's now more than 30 different cell and gene therapy development companies that are here now in Philadelphia. You heard Dr. June talk about 3 of them that have come out of his lab. We have now seen more than a 500% increase in venture capital funding in the last 18 months here in Philadelphia. And those group of companies have created more than 3,000 jobs, which in biotech, you often apply appropriately a multiplier of something like 5 times to what it means around all the other industries and subspecialties that are sort of working to support a company like that. So it was an easy choice, and it was one that was supported by facts that we thought could help really nurture and support the growth of Spark, and it has. And in turn, I think we have helped as a company. I think we are very, very proud of our roots here, and we think we have helped build and grow West Philadelphia in particular. Spark has grown from 3 people in 2013 to more than 400 employees today, with the vast majority of them here. We have invested tens of millions of dollars in our facilities. We now occupy more than 122,000 square feet of real estate space in West Philadelphia in 5 different facilities. And importantly, we have built a company that can do everything from discovery to development to manufacturing and now commercialization. And so we have the talent within our company and been able to demonstrate that you can build the talent pool necessary to go all the way from the beginning, from the bench, all the way through manufacture and bringing it ultimately to patients. And so that idea of building a fully integrated company, I will tell you there are certainly hubs in other areas around this country that can specialize in one aspect of those or maybe a few aspects of those, but being able to have and demonstrate that we built a company that can do all of that is important, and I think is critical in particular in areas like rare disease and in these areas like cell and gene transfer, where you have to be able to, and there's critical importance to be able to keep all those pieces together. For those of you that are not as familiar with the city, you may not know some of the important facts that it's probably worth just covering before I close. The city ranks in terms of U.S. cities in receipt of NIH funding. It is 3rd in the United States in 2017 in terms of NIH funding. It is estimated that 1 of every 6 doctors is trained in Philadelphia. And so one way, shape, or form, they pass through here. And so you will be able to recruit people who want to come back to a place that they likely fondly remember during their training in some way, shape, or form. And 20% of the city's workforce is employed in the healthcare sector. And as has been spoken about before, I think we are living in a moment where this is the beginning, not just of multiple decades of this science being applied to the many, many different diseases, not just rare diseases, but eventually to not only areas of cancer, but to common disorders as well. But I think we're living through a moment where that niche area of science applied to many diseases is also reflective of this technology being the core of what this region is so excellent at. And so owning that, being as great as we are at that already, and recognizing that that's where the future of medicine is going is a tremendous advantage specifically for this region. So I would hope that you who are thinking about this region would join us at Spark and many of the others that are here today in capitalizing on this moment to strengthen not only our position in genetic medicine, but be at the forefront and in the epicenter of where the future of medicine is going, which is here in Philadelphia. So thank you again for having me, and again, appreciate it.